Hi, everyone. Welcome to tonight's KSB Wellness presentation. I'm Dr. Kyle Swanson alongside Dr. Sarah Kubik. And with the upcoming seasonal change and snow and slippery weather, we would like to discuss ankle sprains and hopefully can teach you some things and give you some tips on how to stay safe this winter season. So, topics we're going to cover today, we will go over some types of ankle sprains and touch a little bit on the anatomy as well. Grades of sprains, which determines the best treatment options, exam findings that we will see in the clinical setting, and then we will go over treatment options, and lastly, touch on preventative measures. So now I'd like to turn it over to Dr. Kubik.
Hi, my name is Dr. Kubik. Like Dr. Swanson said, I'm going to be going over the different types of ankle sprains. So some of the different types of ankle sprains that we see, these are typically resulting from some type of twisting injury. A lot of the times we see this from landing on an uneven surface or when people are walking on uneven surfaces. This also is a little bit more prevalent in the winter time when it's really slippery outside. A lot of different ligaments can be affected during ankle sprains. Typically, we'll see the outer ankle ligaments. So as you can kind of see in this picture, as the ankle goes in like this, those outside ligaments can be injured. Most typically, the ATFL or that front ligament is affected, but you can injure multiple ligaments at the same time, unfortunately. You can also injure the inside ankle ligaments or the deltoid ligament, which is on the medial side of your ankle, as well as a high ankle sprain. So this is up at like the front of the ankle, and this is what we call the syndesmosis. And so that holds the two long bones of the leg together, the tibia and the fibula. And you can sprain the ligament in between those two bones, which can be quite painful. We grade all of these ankle sprains on a number system. So with number one, grade one being the most mild of the injuries, this is more of just like a stretching of those ligaments, no actual rupture. These are typically a little bit more mild as far as pain level goes and swelling. Grade two, instead of just being stretching, there can be mild tears of the ligament. We will see some laxity on exam, meaning when we stress your ankle ligaments or when we stress your ankle, it might be a little bit more mobile than normal. These are a little bit more painful than grade one. And grade three, instead of that partial tear, we can have a complete rupture of those ligaments. A lot of times patients will complain of hearing a pop, and this will unfortunately make it difficult to walk and be a little bit more painful. Some of the exam findings that we will see when patients come in with ankle sprains are some pain, bruising, swelling, and difficulty walking. A lot of these all depend on the variation or the grade of ankle sprain that the patient developed. If you have chronic sprains or have rolled your ankle multiple times, you can develop what's called ankle instability, which is basically where the ligaments, instead of being nice and strong, they tend to be a little bit more lax. And that unfortunately increases your risk of a future injury. You can have a loss of strength and flexibility, as well as the ability to walk well on uneven surfaces. And I'm going to turn it back over to Dr. Swanson, and he will go over conservative treatment with you guys.
All right, thank you, Dr. Kubik. So regarding conservative treatment, we typically will start with the period of immobilization, which means protect the extremity that has been affected or injured. We may use a cam boot, like that black boot on the right, a short leg cast, even a splint. Other options can be bracing or taping the ankle. Rice therapy, which involves resting, icing, compression, and elevation, can be helpful alongside use of anti-inflammatory when appropriate. And then we really try to minimize activity, and this period may go for approximately 1 to 2 weeks until we start feeling better, and then we increase our activity again. And then other conservative option is physical therapy. Here at KSB, we're very fortunate to have an outstanding physical therapy department, and they help a lot of our patients that have endured a ankle sprain get back to their full activities. So if we have chronic symptoms that last a long time, like Dr. Kubik mentioned, we will experience ankle instability, and this may result in recurrent sprains and risk of additional injuries. This may involve tendon tears, OCD of talus, which means an osteochondral defect, or basically damage to cartilage within the ankle joint. Bone marrow edema, which is inflammation inside the bone, which can be indicative of a stress reaction or stress fracture condition. And even ankle fracture can occur. We can develop knee, hip, or back pain as well. We will start with X-ray in the office, but if we feel appropriate, advanced imaging, including MRI, as in this picture here, can be helpful as well. So surgical treatment options, each patient requires an individualized treatment plan. And so I wanted to list some of the things we do, but not every time does it mean we're doing every single thing on this list. But sometimes an ankle arthroscopy or an ankle scope is appropriate, and that's where we can clean up the ankle joint. We can repair that cartilage injury to the ankle joint as well. Peroneal tendon repair. So there are two tendons that run alongside the outer aspect of the ankle. And with recurrent sprains, sometimes we can develop tears, and these tears may need repaired. And so we debride or remove the unhealthy part of the tendon, and then we may retubularize the tendon, which means we try to restore it back to its anatomical shape the best we can, or sometimes we actually tenodese or sew those two tendons together. Lateral ankle stabilization. So this helps repair those outer ankle ligaments, and sometimes we'll use an anchor, and it acts as almost an internal ankle brace. Rather than wearing one, we can surgically place one inside the ankle. The medial ankle stabilization, which is on the inside part of the ankle, this helps repair the deltoid ligament. Then the ankle syndesmotic repair. So there is a ligament that is between the two leg bones, as Dr. Kubik mentioned, and sometimes we repair this with either screws or a really strong suture. We call it suture with button fixation. And so you can see in this picture here, there's a very small plate on the left side of the long skinny fibula bone, and then there's a suture with a couple buttons on the other side of the tibia, holding that ligament together so that can heal. Prevention. Well, it's always important to wear supportive shoe gear. Inserts or orthotics can be helpful as well. Warming up before activity, and I underline stretching there, that is huge. Keeping our body functioning to its maximum, with making sure everything is nice and warmed up, and stretching and flexible is always important. Remembering your ice therapy after activity, and then addressing any underlying imbalances, whether that be strength, flexibility, proprioception, or balance. And then I also underline physical therapy because that can be very helpful in preventing a worsening injury. So that concludes our presentation this evening. I'd like to thank KSB Community Wellness and Aaron Fox for putting this event on this evening. If anybody that is watching has any issues with their ankles, we'd be more than happy to see you. We can call that number on the screen and make an appointment. We'd be happy to help you out. And we hope that you have a very fun and safe holiday season. And we'll see you next time. Thank you.